Good afternoon, everyone, and thank you very much for joining so promptly. As the clock does strike 1, we'll go ahead and wait for everybody to perhaps still join us who might be late. But as always, thank you very much for joining us in this, apologies, in this one-of-a-kind first-time approach for our webinars, where we'll be having a guest speaker voicing some of her experiences, as well as how she's gone about using Primal Pictures to create an immersive and engaging learning experience for her students, as well as to educate and enhance the delivery of her lesson plans. So for the next hour, we're going to take a look at bringing anatomy to life, voicing the digital education insights of our guest speaker, Jodie Lemphane. Now, as always, we're going to keep the agenda nice and short and simple. I'll simply remind you about the additional support services that are available to every single one of our lecturers and partners within the Primal Pictures community. I'll quickly remind you about our student webinar session taking place next week, Thursday and Friday. I'll also then demonstrate where you can find the additional training resources over on our social media channels. And then I'll go about introducing our guest speaker, walking you through how she's gone ahead and implemented these different types of digital resources to enhance the understanding of anatomy and physiology for her students. And then we'll take a look at deep diving how she's used these different approaches and strategies by opting to focus on both circulation as well as ventilation and explore the vital connection between the cardiopulmonary systems. Now, depending on the amount of time we do have available in the webinar, we'll possibly go through 3 titles, but if not, we're going to take a look at exploring the Anatomy and Physiology virtual textbook. If we do have some time, we'll deep dive over into 3D real-time, and then end things off with the Anatomy Learning Outcomes for Medicine. Also, if you do not have access to any one of the titles that we'll be exploring, please note that every single institution is entitled to a free 30-day trial. And if you would like to explore the anatomy learning outcomes for medicine, please let us know by just popping your email address over in the chat box, and then we'll get back to you with the necessary information shortly. Now, as always, we pride ourselves on making sure that we can continuously support both staff and students. Every single institution within our Primal Pictures family or network is entitled to 6 annual free training sessions dedicated towards assisting staff members with implementing and using the available resources within Primal Pictures at your disposal. We also have our 3 monthly webinars dedicated to staff and students, such as the one you're joining today. In our session for next month, as well as May, we'll be focusing on assisting your students with getting ready and geared up to prepare for the upcoming exams. There's also a dedicated technical support team at client services, apologies, in this case, client services at primalpictures.com to assist with any more technical based queries. If there are any librarians currently on the call and you would like to receive the monthly usage stats automatically sent through to you, please let us know and we can have that set up for you. Now, like I mentioned, we will also be hosting our student webinar sessions next week, focusing on a similar topic, exploring the cardiopulmonary synergy between the cardiovascular system as well as the respiratory systems. And if you'd like your students to benefit from these sessions, please make sure to go ahead and share those previous links in the email that you received for them to register and benefit from this content. Now, as always, I want to take a bit of a step back and explore a bit of a fun approach. So at anatomy_sucks, over on Instagram, YouTube, as well as TikTok, you'll find a variety of different resources. If you'd like your students to register to those webinars, you can redirect them over to our Instagram page where they'll find the appropriate links. Over on YouTube for both yourselves and your students, head over to the playlist section where you'll find a collection of our previous training webinars, as well as the available crash course videos that will discuss all of the different features and benefits across the different titles available to you. And then on TikTok, that's just where we have some fun. We make some fun, light-hearted content that students often tend to relate to, because I'm sure in this case, you fully understand that anatomy as well as physiology can be quite overwhelming for them at times. Now, without any further delay, let's go ahead and introduce our Primal champ. So we have Ms. Jodie Lemphane, who is a dynamic educator and innovator within the health science education space from Stellenbosch University. She specializes in morphological sciences, histology, as well as medical education, and brings about a wealth of knowledge in terms of her teaching and research. Now, she serves as a trailblazer in leveraging off the power of AI-generated assessments. She also focuses on implementing various blended learning strategies, medical education tools, and through her use of these different resources, it's allowed her to create an immersive and engaging learning experience for both undergraduate as well as postgraduate students across a variety of different health science disciplines, including speech language pathology, as well as occupational therapy. Now, with many years of teaching under her belt, this has allowed her to hone her various skills associated with these digital technologies and how she's gone about then creating an immersive learning experience for her students. And through her groundbreaking work, this has been recognized through various prestigious grants, including that of the Finlow Research Grant, which afforded her the opportunity to research the impact of post-pandemic anatomy, anatomy teaching or education. And in addition to that, she actively contributes to various post-reviewed articles or publications and has served, in this case, presented at various international conferences, including ICA and ESCOMS. And so in today's session, she'll be aiming to explore and share some of her insights and experiences, as well as a few tips and tricks on how each and every single one of you joining this webinar can go about using digital education tools, such as Primal Pictures, to not only enhance your own teaching capabilities, but to create a fully engaging and immersive learning experience, saving you time, ensuring that you can thrive in a technologically driven health education ecosystem. In the next slide, I'm going to pass things over to Jodie, where she'll go ahead and touch on how she's gone about using Primal Pictures as an educator.
Okay. Thank you very much, Nasir. I just want to make sure that I'm audible.
Yes, you are.
Perfect. Good afternoon, everyone. Thank you very much for the opportunity to just share with you my experiences as an educator with regards to using the Primal Pictures platform. So I'm going to introduce about 4 titles in the Primal Pictures uh, their offering that I've used thus far over the years as I've been developing as an educator. So initially, when I just started lecturing in 2019, I came across the quizzing function. And where I enjoyed using this function was in revision within class. Just to clarify any blind spots that students had at the time, or also to encourage engagement in class. As we know, students in higher education, in medical education, they are very digitally savvy. So training them in class how to use this particular tool was fantastic because they could then go back and use it as a revision tool for when they were writing their tests. They could also start to collaborate in the class and learn from their peers, which I think was some of the unintentional benefits that came about by using this Primal tool. Um, when I was doing preparing for the webinar, I again rediscovered just how fantastic the quizzing is, and it includes all the different parts of the body, so I would highly suggest it. Then, more recently, I had to teach the musculoskeletal system to students, and this was quite daunting for me as I hadn't done it before. And after the sessions, after we'd completed the lectures, I started to wonder whether there was a way for me to solidify the knowledge for the students. And I was looking for something we could do in class that wasn't too active, but was active enough where they could start to use these muscles all in one. And then I came across the yoga function in terms of the functional anatomy offering on Primal Pictures. And what was fantastic here is that I could develop a small worksheet for my students, tell them, okay, these are the 9 poses I want you to go through, and then ask them to use any resource that you want to. But tell me the muscles that are used to do this pose. And all I give them is the pose and or the English name for it, and then the yoga name for it, and then send them on their merry way. And then after the session, so they'll split in groups, they will go and do these poses, learn from one another, look at resources online, and hopefully also look at the primal content. At the end of the session, I'll then present the primal content, as you can see there on the right, an example, and we will go through the muscles that are involved, and then also just clarify any gaps for them. So in future, I actually want to use the resistance training offering on Primal as well as the Pilates offering, depending on the student group that I'm looking at. But I also want to use various sports. And again, it's just a post-class activity, or once they've gone through all the sessions with you, just looking at some of these poses or some of the movements that are there, the videos that are there, to help students solidify their knowledge again. This leads nicely into the functional videos, or the functional anatomy videos that are available there. This again I came across when I was struggling to show students the movements of the larynx. And yes, we have plastic models in class, but you're presenting in a flat venue, and there's students in different rows and things like that. And they can see it on the screen, or they can see your plastic model there, but it's so much nicer for them to see it on their own device. So what was really great is that I came across these videos that even show the movements of the larynx, which I think is fantastic. And then more recently, I taught on the muscles of mastication. So once again, I called on these videos, because it's one thing standing in front of the class as the educator and doing the movements, asking the students to do the movements. Okay, while you are depressing your chin, um, feel or palpate how or which muscle is involved in it. But it's another thing when they can actually visualize it and see it, and go back to these videos. So I input the videos or embed them in my lecture, and I give the students the links so they can look at it once again during their own revision. The last resource is probably the one that I I think is the greatest, and I'm really thankful that our institution gives us access to this. This is the learning outcomes for medicine title which they have, and where this resource is so fantastic is that it puts together the standard anatomy learning outcomes that were published, I think it was by Smith et al. In 2015. So each outcome has its own explanatory video, and then it also has direct links to specific models in 3D real time, followed by some additional pictures that students can use. Where I used this was last year with my medical students. I myself was trying to just revise before the sessions, and I had attended the webinar with Stefan Nathir on this, and I was like, "Ooh, I really hope we get this," because the videos are just such nice, fantastic summaries of singular learning outcomes, which I haven't seen before. Many other videos you get online will include a variety of outcomes, and they can sometimes be a little bit confusing to the students. But the whole structure of the way they've set it up and approached it really does encourage learning. So I gave my students the links for these videos to help them find it. It was all aligned directly to the content I was teaching, and it even made other models that I wasn't aware of in the Primal offering it made me aware of those, which was also fantastic as an educator. So these are just the four titles that I've used. But I'm sure there's many others. I'm sure there's many other ways we could use it, and I'm willing to learn, and I appreciate any feedback from my colleagues. I'm just a young educator, and I know there's many other ways to do this, but that is all from me. Thank you very much, Nathir and Steph.
Thank you very much, Jodie. And I think just based off all of the comments and experiences that you've shared with everybody at the moment, it's left everybody with a lot more confidence going into their next exploration for Primal. Before we hop over into the live demonstration, I just want to once again remind each and every one of you in terms of access. Now, Primal Pictures, like you know, it is a web-based application, and the primary method of accessing it, if you haven't before, is to go via your library database. If you're on campus, there is the option to simply be connected to the university Wi-Fi. Head over to anatomy.tv and that will go about logging you onto the platform. You will have access to 2 mobile apps that you can download and use completely offline. Please also make sure that you download them when on campus. Up to 90% of the content available to you that both Jodie's been using as well as that we'll be focusing on today can be downloaded for offline purposes. And you can also embed the content into your learning management system, whether that be Moodle, Canvas, or Blackboard. Also, if you'd like access to the faculty area section so that you can go about downloading the quizzes, the clinical examples, as well as any of the other, how can I put this, any of the other more niche-based content that you can find directly within the titles, but in a slightly different format, please let us know by just popping over a message in the chat box, and we can set up access for you in the faculty area. So that brings us towards the end of the presentation standpoint. Next, as I stop sharing the presentation and reshare my screen, we're going to walk through exploring the interconnectedness between the cardiovascular system and the respiratory system, taking a look at using some of those innovative strategies that Jodie's been exploring. Also, please just let me know if my audio as well as my visuals are coming through okay once I share my screen by just either popping a reaction with a thumbs up, and I'll be able to monitor that. Steph, if you're able to also please just monitor the chat box, that would be great.
Will do. Thank you very much. The visuals are loading now and everything looks good. Thank you.
Perfect. So everyone, as always, we're going to go ahead and start things off by moving quite simple and easy, beginning with our virtual textbook. So to kick things off, as always, this is where you can go about encompassing both anatomy and physiology through a guided learning experience. This would encompass 20 modules for 11 different systems, marrying together structure and function. And it's also where you can find a collection of case studies, interactive learning activities, as well as various learning objectives to help break down the appropriate content for those systems, allowing your students to further their understanding and comprehension. For today's purpose, we're going to make use of the respiratory system. Now, as the system opens, I firstly want to go ahead and just assist you with orientating yourselves, because once you become familiar with using the anatomy and physiology title, the overall user interface will look, feel, and function exactly the same for the likes of functional anatomy, 3D Atlas, as well as imaging and a few other titles. It'll first start off with a variety of topics, or in this case, various lesson plans, discussing the macroanatomy, microanatomy, any histology or the associated physiology for that system. And in today's purpose, we're going to focus on voice production, because as you saw in the presentation, using those different functional animations, Jodie was able to effectively assist the students with better identifying and understanding the complex actions or functions for those muscles. Before we go ahead and take a look at those functional sections, using the 3D model in the center, I can use my up and down arrows below that 3D model to add in some of those associated muscles. I can then either use my mouse to rotate that model to try and identify the structures, or the left and right arrow. And then as I select, for example, the retinoid muscle, it'll highlight it so I can better identify its location. And then using that explanatory information alongside, that's where I can guide my students to better understand and comprehend the structures, or in this case, apologies, or in this case, a physiological process that they might be struggling to understand. And you can break that down even further using those different learning objectives. So if I had to describe to a group of students focusing on the movements of the vocal cords, I could jump down to that appropriate learning objective. I can then also use those functional animations, and all of these can be downloaded and then inserted into a PowerPoint presentation. Moving back to the original focus or topic, whereby we want to explore some of the content associated with the cardiovascular system as well as the pulmonary system. We'll jump over into pulmonary ventilation, followed by the respiratory membrane and gaseous exchange. Now, using some of these first examples, we can clearly focus on, in this case, learning and assisting our students to better understand the properties for these muscles. If you want to visualize the diaphragm, we're now able to isolate that muscle. We can take a look at using the explanatory information to assist them with understanding its origin, its insertion, as well as its action and contraction, to then perform its associated function. So as I click on the functional animation, it'll then showcase or demonstrate what action that muscle performs when assisting with contraction for the diaphragm. And likewise, as I move and follow along and complete some of those different learning objectives, I could then also be greeted with some interactive learning activities to then share or test my students' recall capabilities. Those could vary either in the form of a click the structure. So in this case, I can now test my students' ability to identify some of those muscles. In this case, those external intercostal muscles or the internal ones. Likewise, because many of the 3D models are also, are also accompanied by authentic dissection images, you could perhaps jump over to the upper respiratory tract. If I wanted to focus on, just as an example, taking a look at the soft and hard palate, I can select a dissection image for the nasal cavity. This content can be quite sensitive, so I'm going to open up an example, and these will still be fully interactive. And likewise, if I wanted to visualize something based on more histology, I can do that as well. Moving back over to the lung volumes and capacity, if we then want to take a look at exploring how each of those different phases occur, we can break them down individually. If our students are more visual-based and we want to make use of a video, we can scroll up and then make use of this narrated guide, discussing or exploring each of the different phases involved in lung volumes and capacity, followed by then hopping over to explore the respiratory membrane and gaseous exchange, scrolling all the way down until we take a look at external respiration, using those complex videos to break down and simplify the content that we want our students to understand. Once we're completed with that, there's also a collection of quizzes. Now, for the original interactive learning activities that you saw, you can quickly find those over at the beaker icon. If I were to expand voice production as an example, here you'll see there are two different quizzes, which I can also find at the light bulb icon. The nice thing about these quizzes is that you as the lecturer, you're able to download these from the faculty area as simply the questions or the questions and answers. You can freely change, or in this case, adapt those questions to your liking, to use for any formal testing scenarios or settings, or to perhaps just test your students' knowledge on the fly. However, if you were to use them during a live demonstration or lecture, you're provided with feedback in terms of whether or not you're correct or incorrect. Now, we can try and match these, but to save some time, I'm going to go with an easy example of voice production. So here, hopefully I was correct in identifying the appropriate muscle. So because I was incorrect, I then get the necessary feedback. However, in the second answer, apologies, in the second question, if I need to go ahead and identify the appropriate muscle, and I was correct in this case, it would give me the necessary feedback. Now, as always, if you couldn't translate this information or take it from paper to practice, in this case, assisting your more senior students with transitioning from basic medical sciences into their senior years, then it wouldn't be very useful, especially to you as a lecturer. And so that's where I always want to redirect you to the clinical correlate section, because that breaks things down into some nice bite-sized chunks using various clinical examples, the aging-related information, which then discusses the effect of the normal aging process on the respiratory system in this example. And then there's all-important case studies, which will be especially useful for medical students as well as any nursing students. If I use the example of a pneumothorax or a pulmonary embolism, you then get the overview for this condition, the associated causes, symptoms, diagnosis, and treatment, and then an accompanying image for that condition. It could either be a radiological scan or the physical representation of that condition on a patient. If I were to jump over to asthma or lung cancer, it would then show me what that condition looks like. Now, likewise for aging, this is fairly easy and self-explanatory to understand, and thus you can use these to quickly assess as well as introduce to your students, especially those who are transitioning to their more clinical years or their more senior practice, to then quickly refresh their knowledge. Before then forcing them to think a lot more critically and apply this information practically. If we use the case studies, and I'm going to go through a few of these examples, and then stop over at the larynx. So in this case, you'll first be presented with a short scenario, or your students would be presented with said scenario. And here we have Gordon, a 65-year-old man who has undergone surgery to remove his thyroid. And in this case, understanding how the removal of said gland would affect his associated anatomy and physiology is going to be extremely important to ensure that your students can effectively manage or treat this patient's condition, and also go about answering the necessary questions for their test papers. And this is where you can once again remind them that anatomy and physiology cannot be viewed in isolation, and that what happens to structure ultimately affects function. As I close up these, I also just want to point out that you can quickly share this content as a link. So if you're somebody who relies heavily on using PowerPoint slides and presentations, and you're struggling to find a resource or an example to, in this case, simulate what your students would need to understand, using this video, I can click this link, I can then hyperlink that in my presentation, or I can open up the Internet Explorer. As you'll see in just a second, I'll insert this exact link, and this will take me over to that video, which I can then use during a live demonstration to assist my students with understanding external respiration or any one of the other functions. If you want to, in this case, embed the content as well, when you go about embedding 3D models, using, just as an example, pulmonary ventilation, please note that it will still retain the 3D aspect, meaning you can still fully rotate and manipulate those models. Just jumping back to the embed function, let's say at your institution, you're either using Moodle, Canvas, or Blackboard. It'll auto-generate that code for you to then copy and insert into your LMS. If you're struggling with this, please reach out to your technical support at your university to then assist. And then once you're done, if you want to download any one of these functional animations, for example, with the diaphragm, I could save this video or movie, as well as the topic PDF. The nice thing about the topic PDF is that it then merges those 3D models, or in this case, the videos in a flat aspect, which you can download separately, but it still retains all of the associated information that your students can then use offline, or that you can then use offline during a practical or demonstration with your students. Now next, because we do still have quite a bit of time, we're going to hop over into 3D real time to now explore the thorax, hopping over into the cardiovascular system, as well as interconnectedness once again between the respiratory system. I do just want to apologize beforehand that if my models appear a bit clunky in 3D real time, it's simply due to the fact that I'm currently sharing my screen on Teams. And that when you go about using these 3D models, they'll move quite seamless and easy. There we go. Now, as always, just to go ahead and orientate ourselves, on the left-hand side, you'll have all of the associated options, beginning with your text box, ending all the way down with your navigational trackpad. In the center is where you'll have your 3D model, together with the various virtual dissection tools. And then also, the one thing you'll have on the far right-hand side are all of those associated categories or systems to go about creating your own customizable 3D model. Because the really important benefit afforded to both you as staff members and students is that this resource is 100% user-driven. And the fact that you're able to also use it on any device, whether that be a smartphone, a tablet, or your mobile, apologies, or your PC/laptop, it allows you that flexibility to take learning on the go. Within the mobile app version, you can then perform the virtual dissection completely offline and also activate augmented reality to then fully immerse your students in the wonderful world of anatomy in this case. Instead of creating a highly detailed model, to focus on saving you some time, I'm simply going to hit clear to remove my model, but then jump over to the window icon, because that's where you'll find a collection of dissection images, as well as the pre-made models. For this purpose, we're going to make use of the heart and lungs. But let's go with the middle model, and you'll notice how you have 5 different pre-made layers of different tissue depths, starting off with superficial, working our way down to the deepest layer, where we just have the heart. I could also fully customize this if I wanted to, whereby I could open up the heart as I expand the left heart or the right heart. I can pick and choose from any one of these individual structures. I could remove the pericardia, or I could remove the individual lobes for the lungs. So I'll leave things as is. Now, as I rotate this model, I'll still have all the other labels to then quickly identify the appropriate structures or pieces of anatomy. As I click the superior lobe for the right lung, I can hop over to the text box to give my students some additional context. And as I click on the middle lobe or the inferior lobe, you'll notice how it then highlights those structures in a different corresponding color. And that's to thus assist your students with getting a better understanding of the concept of both spatial awareness, as well as how to improve their identification, so that they can accurately and confidently identify these structures from any angle, anywhere, and at any time. As I bring this model back to an anterior view, if I click on the fibrous pericardium, you'll see it also now lists some of the functions or the physiology associated with that structure. And at the very bottom, there's a few associated media options. Those could be different pre-made models or some of those different dissection images. So we're going to open up one of those again. And like I mentioned initially, this content can be sensitive. So we'll go with something like the diaphragm. I'm going to half maximize my dissection image. And here we have the implementation of what we like to refer to as a digital twin, allowing your students, as well as you as the lecturer, to give your students, whether that be medicine, nursing, or physiotherapy, or any other discipline, first-hand experience to become more comfortable with identifying these structures, and to also assist them with overcoming that fear of failure, especially your medical students when they go about dissecting. Knowing that they have a 3D model that they can quickly restore with all of the structures in a pristine state gives them the confidence level to go about identifying and learning with confidence. As I click on the diaphragm, just as an example, you'll see how it highlights that structure. I can also take a look at the positioning of the parietal pleura. If I then go ahead and hide, for example, one of the pleurum. I can select the diaphragm or the central tendon. And I can do that by selecting either structure on any one of the visible models. If I still want to have the dissection image open, and I want to focus on the lungs, let's go ahead and close this image. Let's opt for a right section of the mediastinum. I'll leave my dissection image open, but jump over to the text box. And you'll see as I click on those associated structures, I can still use the dissection image together with my 3D model that's fully interactive and have all the associated explanatory text, guiding my students to the origin, insertion, as well as the innervation and any action associated with that muscle. If we now hop back to the original 3D model that we used, I can also go about either creating my own customized labeled study notes or diagrams. But before I do that, like you saw with the dissection image, something that's very difficult for the students to often comprehend and understand when moving from a 2D image in a textbook to a 3D model, followed by their body donor, and then eventually their patient. They can't exactly remove their patient's skin. And so it's important that they have a good, thorough introduction, as well as a good knowledge base about those anatomical structures, and to force them to think a lot more critically and test their understanding. If you hop down to the gear icon, you can activate the dissection color filter to now mimic or replicate what they would typically see in the dissection hall. Now, I like to use the coronary arteries, but let's go ahead and maybe use the example of the lobes. So now the students have to really think about the location, as well as the different properties and the structures that each of those lobes surround. If I wanted to, I could go about inspecting the superior lobe to take a look at its structure. If I wanted to examine its location within the thoracic cavity, or I can completely ghost it and take a look at those different bronchi. I'll hide it, and then I can engage with those finer structures or details. When you typically provide your students with a test paper, those images are also black and white. So you could simulate that using the outline filters. Also, it's very important to note that each and every single one of these images within Primal Pictures, you have the full copyright licensing to use these for any in-house presentations, workshops, research, and seminars, and also to go about creating some customized test questions for your exams to then present to your students. And you can then create those customized label diagrams using any of these different filtrations. So as an example, if I jump down to the pencil and ruler icon, I'm going to throw in a few pins into these different structures. Oh, my apologies. I'm going to throw in a few pins into these different structures. I can then either leave it colorized as is. I could opt for the dissection color filter or the outline filter, but I'm going to leave it in its normal version. I can then remove the names from those pins, but I can also adapt them to then create some questions. So I could say identify this lobe and its function. For the diaphragm, as an example, I could say list the origin and insertion. And if I wanted to create a customized case study to then assist my students with really thinking a lot more critically, just using a freestanding text box, I can toss in, let's say, CSV and RESP case study. I can then create a little scenario. Let's say we have John Doe, a 65-year-old male, and then whatever potential medical condition or information you'd like to insert. Following that, you can create a full list of questions to then assist your students. There's also just some free draw tools that you can then go about using to help your students identify or focus on anything of clinical relevance, or that you may have pointed out during a dissection. Or if you want to follow the course or border of some of those different structures. And once you feel that you've created something that would be useful to then either download and use for a formal testing scenario, or to then implement into your lecture notes or slides, hop over down to the camera. If you save it to your favorites, let's say CVS, RISP, that will then allow me to come back to this customized slide to then change and adapt to my liking. As I download it, I'll simply confirm. This will pop up in the downloads folder on the device that I'm using, in this case, the laptop. And also, please note that the black background is predominantly due to the fact that my computer is currently on dark mode, and that when you go ahead and insert this into a PowerPoint presentation, or you print this for a physical slide, it'll remove this for you. The only other addition, if you might be collaborating with some of your fellow lecturers, you can quickly share the customized slide by simply moving down to the share link. If that lecturer decides to save it to their favorites, or you have, you can copy that link. Simply hit copy overhead. And if I jump back over, as you'll see in just a second, it'll then redirect me to the customized slide that I've created. There we go. So the only other addition that I'll just quickly walk you through is demonstrating what using the augmented reality feature looks like. So if we were to touch on the cardiovascular system as well as the pulmonary system or the respiratory system, for this example, I'm just going to use the head and neck because this is also one of Jodie's specialties. So as I play this video, I'm now performing the virtual dissection, assisting my students with becoming a lot more comfortable to identify those different structures, whether that be associated with the larynx or the muscles of mastication. And I'm doing all of this completely offline. You'll see in just a moment, I'm able to also activate those different coloration filters. In this case, the dissection colors. As I scroll past, I can also create some customized slides or labeled notes to, in this case, quickly remind myself, either in preparation for a lecture or presentation. If you were to jump over to the window icon, you can still use those pre-made models and the dissection images. And as I scroll past to the point where we now switch our camera to augmented reality, preferably, I would highly recommend that you ask your students to switch it to surface just as a first off attempt. This will then transmit, or in this case, project that 3D model of whatever you'd like your students to visualize or revise through their camera, allowing them to superimpose and also identify the structures. They could either place them alongside their fellow students, their body donor during a practical demonstration, or even alongside their patients within a hospital setting to provide some patient education, or also quickly identify and refresh their knowledge. And if I wanted to focus on the muscles of mastication or the larynx, I could even physically move my cell phone into the cranial cavity itself, walking my way down the larynx to the bronchi and the heart, taking a look at how the structures are interconnected. Next, I am aware that we have about 15 minutes left, so let's go ahead and finish things off with exploring the anatomy learning outcomes for medicine. Now, for those of you who might not be familiar with this title, Primal Pictures saw the need to help create to help create some educational content that streamlines the anatomical syllabus specific to the undergraduate degree of medicine, or MBCHB. Primal in turn licensed these outcomes from the Anatomical Society of the UK and Ireland, and together with an editorial board of 50 leading experts, created a combination of narrated or explanatory tutorials, combining both 3D real-time virtual dissection space, some interactive radiological imaging, as well as a variety of clinical videos discussing over 88 common diseases and conditions. And all of these are available across some of the titles that you may already have, such as 3D Atlas or the Diseases and Conditions title. For this purpose, because we're focusing on the cardiovascular system as well as the respiratory system, let's make use of Learning Outcome 71. Because what I do want to point out is, after every single region, or towards the end of every single region, it'll take a focused approach on assisting your students with how to identify various anatomical structures using a radiological approach, whether that be an X-ray, a CT scan, or an MRI, combining those interactive 3D models all in one concise place. As I play Dr. Taylor's video, we don't exactly need a lecture, but like Jodie mentioned in the presentation, these are extremely useful to either share with your students before lecture, so that when they come to the session, because the available time that you have with them can be quite short and limited, so they can then bring all of the associated technical questions, allowing you to focus on engaging in a lot more detailed discussion. Or you could share this post-lecture, allowing them to then revise the associated structures and content that you may have covered. Now, using the different chapter markings, I could click on the type of diagnostic imaging, which Dr. Taylor will then discuss, or I could move over to a thoracic CT image. And I could also follow along down below to identify those key structures, which will then use the 3D real-time interface. And as this loads, in this case, as I scroll up, I can download the transcript to then revise everything that my presenter is saying. And I can also then use the picture-by-picture mode, as you'll see in just a moment, so that I can still have the narrated overview in the corner during a live demonstration, as I then explore and assist my students with identifying each of those individual structures that Dr. Taylor would then discuss. There's also some pre-made models that you'll find over at the star icon that specifically speak to the content that he's exploring. Once you're completed with that, there's also some additional content options. If your students are still struggling to visualize those different concepts, yeah, I could use those 3D models taken from 3D Atlas, but you can also find them within the functional anatomy and therapy section. Some of these labeled slides or diagrams, a comparison between a female chest as well as the male chest using an X-ray. And then there's interactive radiological scans. And you'll find them for either a coronal, a sagittal, or coronal, sagittal, as well as any other potential view. And as I click on the structures, you'll see how the corresponding piece of anatomy is then highlighted. At the very end, once you've completed exploring some of the normal gross anatomy, as well as the physiology, you can then tie that all together and use some of those explanatory videos taken from the Diseases and Conditions title, which will then discuss the anatomical consequences, as well as the pathophysiology for that specific condition, detailing the differences between normal anatomy, the development of that disease, together with the anatomical consequences, and then the associated causes, symptoms, and available treatment options. And because that content has been created with patient education in mind, there are comprehensive PDFs that you can find within the Diseases and Conditions section to quickly download, as well as summarize all of those associated factors. You can then once again share this content with your students, embedding them, or in this case, placing them into a PowerPoint slide, or directly embedding them into your learning management system. And your students can also track their own individual progress, as well as you, using the personal profile. So that brings us towards the end of our session. To quickly summarize what we explored, we first of all touched on using 3 different titles, starting off with the anatomy and physiology title, recapping and refreshing how we can use the content within the respiratory system, whether that be the functional animations, those different dissection slides, alongside the explanatory information to create a guided learning experience for our students and increase their comprehension. That's also where you can go about, once again, finding those different case studies, the clinical examples, and the interactive learning activities that you can download from the faculty area over here. Simply go ahead and click the relevant prompt. It'll then ask you to insert the unique faculty access password as well as the username. And like I mentioned, if you would like access, please let us know. We then hopped over to 3D real-time, exploring a combination of both the cardiovascular system and the respiratory system in tandem, taking a look at how we can create our own customizable 3D models and label diagrams to assist our students with furthering their understanding of spatial awareness, as well as how to identify structures a lot more confidently, and also create a fully immersive learning experience using the offline mobile app and augmented reality. And at the very end, we hopped over into the anatomy learning outcomes for medicine and how those explanatory guides really help us not only save time, but give our students a different lens or introduction in terms of the type of content they need to understand before lecture, and also to then revise that content so that they can be competent, confident professionals, in this case, as they develop their understanding for both anatomy and physiology. Now, I know today was a lot of content, and so if you're feeling lost, please remember that we also have the additional training videos. Those you can find over at anatomy_sucks. Go ahead and search it exactly as you see it on screen. Head over to the playlists. If you're keen to learn more about the anatomy learning outcomes for medicine title, I would suggest you take a look at the webinar training series, where you'll find a full 40-minute video discussing the different features. But head over to the crash course tutorials or videos, and that will discuss where you can use all of the different features and benefits available across the different titles at your disposal, as well as how to activate augmented reality and download the app if that's something you'd like to implement in your teaching practice. I'm going to hop back into the meeting and stop sharing my screen. And if there are any questions, comments, or observations, please feel free to go ahead and let us know. You can either pop your comments over in the chat box, or we can provide you with access to your mic.
Thank you so much for that, Nithya. And I just want to say a large thank you to Jodie for your insights and for sharing your experience. We really appreciate it. Nithya, I just wanted to share with you that there were some questions or comments in the chat box, but I have addressed all of them. So to all of the attendees, if there's any further questions, please do let us know. But if not, I really hope this session has been helpful to you and that you enjoyed listening to Jodie's experience as much as we did.
Thanks for that as well, Steph. So everybody, if there aren't any other questions, you're welcome to go ahead and hop off the session. You will receive a recording of the session before the end of today to then review, and you're welcome to share this with your students. And also, we hope to potentially see some of you in our future webinars, whether that be as a guest presenter, sharing your thoughts and opinions. But until next time, thank you everyone. I wish you a wonderful day and a good long weekend ahead.